Welcome to another broadcast by the UK Medical Freedom Alliance, the UK's most recognised and respected organisation advocating for every individual's right to informed consent, bodily autonomy and medical choice. We are the UK's voice of ethical medicine. Hi and welcome back to the UK Medical Freedom Alliance. This is another one of our broadcasts which I hope you're really going to enjoy because it is so informative and in fact it really impacts us all. This is something I think we should all do, and that is to sign up for something called My Medical Choice. It gives you full autonomy and choice about your medical interface with the NHS or any other doctors, paramedics, etc. Very, very, very important. Now you're going to hear a discount code discussed during the broadcast. That discount code is, so please note it now, it's UKMEDMMC. That's UKMEDMMC. So now let's find out all about the People's Health Alliance and how they became involved with My Medical Choice with Lisa and Gio. Please sign up to receive our newsletter and you'll be notified of UK MFA campaigns, open letters, calls to action and any important updates. You can do this on our website at ukmedfreedom.org. That's ukmedfreedom.org. So Lisa, Gio, thanks so much for joining me on the UK MFA podcast. We've been really looking forward to talking to you about My Medical Choice and how you became involved in it. I guess really I'd like to know right from the start, maybe a little bit about the People's Health Alliance and how that got going, and then how that then fed into what you're now doing with My Medical Choice. So Lisa, maybe you should start. I think because you were the prime mover there, I think.
I was one of the founding members, but it's literally been a team effort from the get-go. And so it began, I guess, the end of 2021, and a group of like-minded people came together because we could see what was going on within the NHS, that, you know, there was an ambulance crisis, etc., and that we needed to start taking action and providing a safety net for people within their communities. So the vision, which was very simple from the beginning, was to empower people to take that responsibility for their health. And to facilitate that, we felt that we needed to come back to community. People needed to come together and serve each other and help each other. And if we could bring people together in health hubs around the country that provided a fully integrative approach for health, and that was going to be a good start. And we launched in April 2022 on a budget of like £300, I think we started with, just to get the website launched. Very exciting times. It was so well received. People were crying out for something like this. It became evident very quickly. And then in June 22, 3 months after launching, Catherine, another one of the founding members, did an interview with Pam Gregory, the astrologer. Okay. And that just went internationally. It just took off. And people were just, coming to us in their droves, talking about this very simple vision that they'd shared for decades and just didn't know how to get started. So I think the exciting part of that is it starts with one person, and then two, then three, and then before you know, everybody wants to get involved. Sure. Because it's a shared vision around the world. It's just not owned by anybody. It's just a global vision for people to have the freedom to make health choices, to be informed and give informed consent, and to be educated in terms of making informed consent. And that's what PHA does. It educates, facilitates and collaborates with great organisations like yourself that are also working hard to help people.
Yeah, very much along the same lines and with the same remit in a way, isn't it? And what kind of resources did you have on the website, or do you have on the website now for people?
Oh, do you want to take that one, Gio?
It's the right list. I think going back to also what Lisa was saying, a lot of people felt alone as well. So always progressing to setting up hubs and in different communities, people just were crying for getting together and being with other people, and giving them something like that gave them so much hope. And also they started to feel better and feel good because they're mixing with people. So PHA really helping set up hubs everywhere, that was a big thing, and it was just a great progression that people were looking for. As for the resources, well, it's growing all the time. Where do you start with that? I mean, there's mental health resources on there, steering people that way, things where, because that seems to be a huge thing at the moment. And so we're trying to point people in the right direction for seeking the right help. There's a huge directory. I think it's almost 800 practitioners of all different modalities. So people can choose what resonates with them and find a practitioner in their area or do it online. And that's a big thing we've done. We've created guides for healthy eating. It's all about taking control of your own health, what you do, instead of relying on others, which is basically what's around us all the time. Rely on this for this, rely on the supermarket for everything. Do it yourself. Take some control.
Do you think mental illness was or mental health was the biggest fallout from this over the last few years?
It's certainly a huge part of it, isn't it? I mean, I think we as a nation and as a world already had, prior to the 4 or 5 years ago events, already had a huge issue with mental health, mental well-being. You know, there were a lot of the investment from governments of developed countries into mental well-being was a tiny fraction of what was being spent in other areas, and still is, and it's gone less and less. So we have to try and at least come together with like-minded organisations and provide a way of plugging that gap that is in the current broken system. So, you know, I mean, we started in April 22 with a hub blueprint, you know, our kind of take on, okay, I want to bring people together. I want to start a hub in my area. What do I need to think about? So that was really the initial resources. And then we also developed, Gio was very much involved in creating a detox protocol, which continues to develop over time. But those really were what we started with. And like Gio said, we've continued to build on that resource library. We have no end of modalities that, you know, we've got round tables, different ways of providing resources now as well, not just PDFs. You know, we've got interviews, we've got workshops, we've got, you know, round tables, self-care manuals, you name it, you know, and that's the beauty of us all coming together and doing this together. It's for the people, by the people. Great.
That's how it should be. I think it's the only way forward, to be perfectly honest.
Yeah.
But, yeah. So, I mean, the reason we wanted to talk was obviously about My Medical Choice, and this is something that I believe had already started before you got involved, but something that I guess through your networks you became, you know, in contact with, and now you're very much involved with it. So how did you get involved in the first place? Well, how did it sort of hit your radar?
I think initially I discovered My Medical Choice pretty much the same month that it was launched, I think, back in October 21. And for me, it was such a relief finding this service, this organisation that actually sprang out of a Stand in the Park group. And then once PHA launched, we kept talking about the informed consent, protecting our bodily autonomy, etc. And I said, hey guys, have you seen My Medical Choice? And it kind of went from there, and we developed a relationship with the founding members, and Gio's taken it from 0 to 60.
Okay. Added fuel to their fire, eh?
It was strange because Lisa pointed it out a long time ago, And at first I looked at it, I thought, nah, they don't do all that. They can't do all that because of, you see what they offer, you think, do they really do this? And as we started looking into it and working with them, I spoke to the team, look, they actually do all this, what they offer, which I'm sure we'll discuss afterwards. But so we actually joined with them and to help them get the word out there about what they can do. And it's phenomenal. I mean, seeing the peace of mind people get is next level, because they don't realize how much power you hold yourself when you go to hospital just by being informed and having extra knowledge, which is exactly what the PHA is about as well, being informed, knowing, empowerment, self-empowerment. And that blew me away. So I ended up being the one me and Lisa working with the project with My Medical Choice and taking it from where it is. But they'd put something in place that was, just people just love it. They smile when they think they've got that much power. They don't realise how much power they have in a hospital environment.
So it was a great bedrock, but they needed someone like yourselves to really, to take it forward. Yeah. Okay, so perhaps you could explain then how My Medical Choice works, and in a nutshell, and then perhaps we'll go into a little bit more detail regarding the actual nuts and bolts. But what's the general way that it works?
Basically, in a nutshell, a person joins My Medical Choice. They're on the system, and that isn't linked to the NHS, by the way. So I wouldn't be concerned that there's no link there. Let's say you were to have an accident. One was to have an accident. You're taken to hospital. The paramedics right away know what medications you're on, whether you've got a pacemaker, different things, because of a card system. They'll scan it. We've worked alongside paramedics to make sure it's exactly what they want for speed and efficiency. But what also happens is behind the scenes, the moment they've scanned the card, it's sent 2 messages out, medical alerts to both your contacts. So even if they ring the numbers, great. If they don't, it's done. So if you go to hospital, hopefully within moments, somebody should be ringing the hospital and saying, Gio's had an accident, what's going on here? So you've already got a team on your case while you're, let's say, not in the right state to talk. There's already people there. So we've put things in place for that.
So we've got the card that you can put in your wallet, which has your login details.
I'll get it further back.
That's it.
No. Seems to keep disappearing.
It was nearly perfect. Yeah.
And I choose to wear a medical alert tag, which you can see there.
It's a bit like the old dog tag. Yeah.
Yeah, I like a good dog tag and a plunge when I'm melting. Yes, there's a couple of ways that you can alert first responders to that. Obviously, they're going to check your pulse points first. So if you're wearing a medical bracelet or necklace, they're going to find that. And they're trained to look for these things. Yeah. Check your wallet. So we have the wallet as well. I even have a screensaver on my phone, which says My Medical Choice. Look for this. So there's several ways that you can alert them to that. And like Gio says, the great thing is, if you're not in a position to speak for yourself, as soon as they access your data, as soon as they log into that, then an SMS alert goes straight to your emergency contacts, and they can then adhere to your wishes that you have hopefully set out in your advanced decision notice or living will.
Okay.
Which again, My Medical Choice provides an amazing, very comprehensive template to lead people through that process of setting up that living will.
Please consider donating to the UKMFA. We are really grateful for all donations, no matter how small. Your donations enable us to continue to lobby for your right to informed consent and medical freedom to be upheld, and to provide resources to educate and empower the public. There are multiple options for donating. One is that you can scan the QR code that's on this video right now, or you can go to the link that is featured in the description below this video, or you can go onto our website and contribute via donor box, or you can buy us a coffee.
The other great thing about the system in an emergency situation is the advanced decision notice that you will set up, and otherwise known as a living will. So that is where you put your wishes in terms of what you want to happen in an emergency situation. and that tells your emergency contacts what your wishes are. Very important to have that discussion with them when you set it up, because people need to know, and they may not always agree with your wishes.
Right.
And you don't want those being overridden. So as soon as first responders access your information, not only do they see your medical history, which can help in that critical golden hour, and also help to reduce the risk of medical error, they also access this living will. So they know if you've decided you won't have a DNR put on you, you may not want to have a blood transfusion for religious or personal reasons, etc. So those wishes are in your living will. And that is the peace of mind. But when you can't speak for yourself, first of all, you've got people speaking for you that you've asked to do that. And also you have set it out in a legal document, a legally binding document. And NHS staff must adhere to that. Okay. If they don't, it's not a matter of recourse to the trust. It's a personal liability, and they know that. So,
and when you say it's legally binding, so is it something that's countersigned by someone else, by a witness or family or whoever?
Yeah. Witnessed.
Yes.
Yeah. Okay, great. That's really good, isn't it? So it saves a lot of problems at the time of entering hospital with number one, the paramedics, doctors trying to ascertain who your family are or who your, in case of emergency contacts, are. They don't have to hunt around for medical history because they've got something that gives them access to it immediately. So it must save an inordinate amount of time, and could be the difference between literally life and death, I guess.
Yeah.
Absolutely.
Well, that's the thing with it. I mean, we mentioned the golden hour. As you know, the golden hour is your first hour from point of accident. And it helps the NHS as well, the paramedics arriving, because if they get there, they need to find out what medications you're on. Before they give you something, if they're going to, do you have a pacemaker? Do you have... But if they can pull all that data within 2 minutes or less, right away they know, right, move on to this. So already they've saved a lot of time, which can not only save people's lives, but also the quality of your life as well. So if you've had, depending on what one has had. So the whole system really is about time and peace of mind, saving time and peace of mind. Something happens, you go to a hospital, you don't have to be overly concerned, oh my God, they're going to ask me all these questions and I'm in a state, how do I answer them? It's done for you. It's your voice. Yeah. So they've got that. They can't override that. And also the time saves. It's just a process. And like we said, it notifies your contacts, which if you, in your ADN, the system we created, you can put notes in there. So if you've got to pick up children from school or you work with looking after a vulnerable person, it's all in there. You can add sections of that and straight away people know what to do. Yeah. So we've tried to make it as peaceful and relaxing and calm as possible as we can.
And, as a pet-loving nation, there's even an option there that you can put whatever you like in the advanced decision notice. But what the team has done is try to make it as comprehensive as possible. So we've tried to think about everything that we think is important to consider. One being, I've got a pet at home, so that people are alerted that there's a pet at home and this person may live on their own, so we need to access the home and sort the pet out. Some of the things in the template people might not want to consider. Things like organ donation, blood transfusions we've mentioned. But we try to make it as comprehensive as possible so that we can think about all these things. Yeah. And it's not an easy process to go through.
You can find the UK Medical Freedom Alliance in most social media locations, in particular Facebook, on X, YouTube, Spotify, and of course Apple Podcasts, and our favoured location of all, Rumble, which is the home of free speech. You'll also find us in the mainstream media and of course the alternative media too. Remember to like, subscribe and follow at every opportunity, and you'll be notified when our next broadcast is becoming available.
For some people it's very simple. I want this, I don't want that. you can take your time on some of the pointers and maybe come back to it at a later date after you've discussed it with family and loved ones, you know. So
Sure. Yeah. So the actual process then, so someone goes onto the website and then they choose to fill out this advanced decision notice. Roughly how long would that take them from start to finish, or would you think?
If they've got the information to hand, an hour and a half with the signatures. Now, someone might think that's a long time. Well, hang on, we're talking about protecting you in a hospital here. So you need to make sure that you think each tick box has a little eye next to it so you can click it for information. Okay. So they're going to want to read. But what we do say to people, it's a comprehensive form. Tick what you know right away and do it there. So afterwards, go back and add the other options. If you think, right, I'm protected, I might think about the rest and go back, and that's what we would always tell people to do. So you've got protection. Don't try and go through it all and think, no, there's a lot of points here. But we try and make it very comprehensive so that every option is covered.
So it's not full and final when you do it. You can keep going back to it and making changes as and when you need to, or if another health matter comes up, then you can add that to your ADN as well.
Yeah, and to your medical history, you can update those at any time with the click of a button. So it's very easy.
One thing we found also is some people may not want, let's say, mRNA-based technology added to them, in whatever. So we've taken that into account within the system. There's actually specifics within it saying, I do not wish to receive this. You can select it. So they can go into hospital knowing fully well that they're protected on that side. They can't give them certain tests to test for certain things, or let's say certain products that they don't want. So we've had to put that in there because people have been asking for this. So we thought, right, we'll give them that. So we put that in there as well.
And if someone were to go against their wishes and do, then that then would be a legally standing document with which to fight a legal matter later.
And the onus is on the individual, not the NHS. The individual that has not adhered to your personal wishes is personally liable.
Right. And
NHS staff know this. So I think you can take that as fairly good assurance that your wishes will be adhered to.
Great. Very good.
One of the things Lisa touched on before was a DNR. Now, I've got in my family, there's vulnerable members in the family, and what's gone on over not just the past few years, if we've noticed hospitals have put DNRs on people without them knowing. They found out afterwards. So we've got a section on that to stop that happening. They have to go and speak to one of the family and say, this is what we're doing. It's like an extra obstacle for them. So they can't just do that because legally now they have to speak to somebody. So we've put that in place as well.
Excellent. And what kind of response have you had from the medical profession and the first responders to this that have come, in sort of direct contact with this method?
Well, strangely enough, we've worked alongside certain first responders to get a system like this in place. What is it you want to see from the moment you arrive? So we've designed it that way. And what is quick access on the form? So when you call the form up, what is it you want to see? What order? So to be honest, they love it. They do like it because it's exactly what they want. The layout. Granted, when you go to hospital, the doctor might not agree with certain decisions what a person may have, but they have to abide by them. Yeah. But we found that quite often we've actually had doctors, GPs calling us saying, I've got a patient going into hospital. What do you advise on this? Like, really? Okay, well, so we've talked about that with them. And what happens is when they go to hospital, the person, and they've got knowledge, the system's back down. Oh, you know about that. And you find, okay, that's a bit strange. But yes, so that's what it does. It empowers people if they're awake. And if they're not in that state, it still covers them.
Great.
Yeah, I think the other great thing about MMC is it's not just for in an emergency. It's also there to empower you, so to educate you about what your rights are, so that you can go into, I don't want to say the lion's den, but you can do that and feel assured that you've done your homework, you know what your rights are, and you know how to deal with the situation. My Medical Choice helps you to understand what your options are. On joining, you also receive a consultation pack. So if you've got to go in to deal with a consultant for elective surgery, this can guide you through those meetings, because they can be pretty daunting with somebody that, first of all, just sees you as a patient, not somebody with rights and your own research, your own thoughts on a surgery. So it empowers the individual by doing that, but also guides in terms of how to get the best out of the meeting. So how you would deal with somebody in the white coat versus how not to get the best outcome. So it really is about empowering people and taking,
as you say, and an education, because we as patients, we don't know this stuff, and we just hand everything over to them and say, well, you're the experts, apparently. Look after me and do the best you can for me.
Yeah.
And you kind of almost negate your own responsibility and give it to someone else.
Yeah.
I think quite often people find out when they need the system. Let's say when someone's in hospital. We've had that a few times where people have called and said, my father's in hospital. And you're like, good grief, how are we going to pull this one out of the bag and get it done that quickly? We've done it, but that isn't the best time to do that, because that person is under a lot of stress. They're getting asked questions. And unless they've got someone there that is with them, that can work with them, it's a very hard thing to do. We have done it, but we would not recommend that, because it might not always work. You might have the next day, something might happen, and you might not be able to get the form signed, say you're in hospital. So I wouldn't leave it till when you're in hospital and then think, oh, give them a call.
Well, it's probably like any other insurance policy, isn't it? That it's probably best you do it when things are calm and, and you can think it through and choose the right one and get everything you need, rather than, as you say, do it all at the last minute and rush and then just get it wrong anyway. So I think that's a really good piece of advice there. So if someone wants to sign up, they go to the website, which is, I think, my-medical-choice.org.
Yeah.
Then what does it cost this person when they actually sign up? And I know there is a small cost, and it is remarkably small, but I'll let you tell me about that.
Yeah, it's £30 a year, which for the amount of the security that you feel, the peace of mind, I think it's absolutely £30 a year. Think about what you spend on your car insurance, your home insurance, your contents, etc., your phone. Oh my gosh, all of this stuff. It really is a drop in the ocean. And to me, it's invaluable. It really is, and my family, for peace of mind. So,
yeah.
At the moment, they can get it for a little bit less, because I think we've got something with UK Medical Freedom Alliance where they can get it at a slightly reduced rate, which going via you guys, they can get a little bit less, which is great. So that's, I think it's $27.50, if I'm right, $27.50 if they go via UK Medical Freedom Alliance and use the let's say the code supplied what you guys have, so they get it for that.
That's very kind of you. I know that you've given me a code for that, which we'll make sure goes on the end of this video, and also will go into the blurb underneath the video.
Just to say, that's a discount for the first year.
Yes, no, it's great.
It's £30 a year going forward to obviously maintain your information and have that quick access to it. So.
Yeah, no, it's kind, and it gets people started. But at £30 a year, as I say, it's really insignificant compared to everything else that we're spending right now, and the costs are going up on everything. So, £30 a month to protect my health and going forward, I think, is nothing. So,
I mean, it's less than a coffee a week, isn't it?
Yeah, definitely. Yeah.
So, or a coffee a month, to be honest.
Exactly.
A coffee a month.
Find out more about the UK Medical Freedom Alliance on our website. That's at ukmedfreedom.org. That's ukmedfreedom.org, where you'll find all the information you need around open letters, our campaigns, our legal template letters, and of course, even these podcasts. You'll find details of the latest one, and you'll be able to access the previous ones too via the links there. Find out more about our team. Sign up for our newsletter. It's all there, and you can even donate too.
I think the other thing that we've not talked about with respect to My Medical Choice is blood, and obviously there's a huge blood scandal at the moment. So yes. I'm going to let Gio talk about this, because this is one of his pet subjects.
Yeah, no, I'm sure it is. You say, because it's really forefront in our minds right now, and.
Yeah, what's been created within the system. Sorry if I'm looking over here, because I'm trying to look at what's going on behind the scenes with My Medical Choice.
That's absolutely fine.
They've got like a control panel, a dashboard, and within there's options to become, let's say, an MMC, My Medical Choice, a blood donor, and there's a blood donor database. Now, what we find is, let's say I was to go to hospital and I would accept blood from a trusted person or a family member. I can put them within that. Some people may find that they know others when certain groups, maybe stand in the park groups, that align with their ethos or what they believe. So it's like, okay, I want you to be my blood donor if something happens. So this happens. This is all for the UK. We have a database like that. And also it saves a lot of time. Last thing you want is to go to hospital and to start having to call up this information. It's all there. The system is built in a way it's around us. I have a cat, for instance, a pet that's diabetic. We've looked at it as, what do I want? What, all that kind of thing, the way we've worked it. And but the blood, many people at the moment, what's going on, that seems to be a big thing, even with My Medical Choice. Can we have this? Can we have that? So we've set it up within there to make sure that they're a lot safer.
Yeah. And can you help to source blood, the blood that the kind of blood they're looking for?
I think what we're more about is giving people options. So for me, under no circumstances, this is my personal preference, no blood transfusions, no blood products. That's my personal choice, and that's in my ADN. But what MMC does is it provides alternatives, so non-blood alternatives in surgeries. Again, it's about educating and empowering the member. Yeah. So it doesn't have to be a blood transfusion. Oh, what are my options? Well, these are your options. So other things you might want to refer to in your legal backup. Yeah. But it's really understanding that there are other options. And the works that, we've worked quite closely with the Jehovah's Witnesses in terms of what they've obviously got this cracked. They've been doing it for a long, long time.
Yes.
So things like cell salvage machines in hospitals, they're already in there. It's just that we, the public, don't know about it. We don't know that the NHS can provide alternatives. So what MMC does, it educates you to know your rights and to know what's available so that you can make informed choices.
Yeah, I suppose some doctors and surgeons have got their own sort of blinkered view as to how they always deal with things, and it's like we always do it this way, so we're never going to mention the alternatives. We're only going to do it the way we've always done it, which is not helpful for those that really want to seek an alternative. Yeah.
I'm with Lisa on that. I also would not have blood with the things we've learnt over time. But strangely enough, a common thing that happens is when people, there's videos on the blog, there's a blog on the site as well about this. When people are empowered and they have this knowledge, there's a common thing that happens. They go to hospital and they talk to the doctor about what they want, and the doctor says, well, that's more expensive. Seriously, that is a common thing. We're like, really? That's the problem here? So that's why it's not offered. I'm surprised to find that certain options are more expensive, but that seems to be a common thing. So that's why they're not told about it, but they are informed, so they have to give it to you. So that's what we try and do.
Yeah, well, that's an interesting approach when under the NHS, the patient isn't technically paying anything at that point, so it's not like it's costing the patient anymore. So they're worried about their own budgets by the sounds of it. Please consider donating to the UKMFA. We are really grateful for all donations, no matter how small. Your donations enable us to continue to lobby for your right to informed consent and medical freedom to be upheld, and to provide resources to educate and empower the public. There are multiple options for donating. One is that you can scan the QR code that's on this video right now, or you can go to the link that is featured in the description below this video, or you can go onto our website and contribute via donor box, or you can buy us a coffee. Gio, you've done a series of videos, I understand, on your website to help people.
Yes, there's My Medical Choice have got videos. There's their own YouTube channel. People are asking for certain things. One, they'd like to understand the video. Some people are better in audio visual. So we've created videos explaining the system, how it works from point of something happening to going through hospital. Others talk about bloods and what's gone on there and what options are available, because there's so much going on with, let's say, the advanced decision notice. People want to know, is it really that safe? Well, yes, it is. Secure, legal, yeah. So we're making more on that to give people more peace of mind to understand, okay, yes, it will protect me like this. So yeah, we've got 4 so far, but we've got a series of another 3 or 4 to come.
Great. I think probably one of my last questions, but the people are worried about their data. They're obviously giving them, you or My Medical Choice, some personal data, medical data. How safe is that data, and where is it stored, and can they be confident that it's their data is not going to be harvested from there?
Yeah, it's stored on secure servers, not accessed by the NHS. So the first responders can see it, as in quickly on the system, but it doesn't tie into the NHS system. We keep it away from all systems of, I don't want to say government systems, all systems that, let's say, have been hacked over time and data has disappeared. Okay. We keep it away from that because ours is on there as well. So we want to make sure it's as secure as possible. Yeah. Yeah, it's pretty secure.
And it's important to note as well that when somebody accesses your information via your tag or whatever, they can only see your information. There's no way for them to go in and amend it or anything else. So it's completely secure from that point of view.
Fantastic.
And if somebody steals your card and access it, the moment they've done that, it's sent out to alerts anyway to your contacts. So they'll be ringing you right away and saying, what's going on? And then you'll know at that point. You log onto the system, hit one button saying change code, bam, code's all changed, nothing. They can't access a thing anymore.
Excellent.
So, yeah.
It sounds like it's been thought through very well. Yeah. And it's just about, as you say, the whole thing's about peace of mind. So you need peace of mind right across the piece, don't you? And sounds like you've really covered it all. No, it's great. Is there anything else you'd like to add before we wrap up?
I think we've covered the key points.
Lovely. Okay.
It works in Ireland and Wales as well. It's a UK thing, just to say. They might have different terminology, like advanced directive. I think that's Scotland and Ireland. But it works there as well. So it does work in the UK. It's not just England-based UK.
Okay. So this is Northern Ireland, but it excludes ERA, I guess. Yeah.
Yes.
Yeah.
Just one other thing I'd add. If you do go to the website, my-medical-choice.org, you'll see there's a section, a frequently asked section, and it's really, really comprehensive. We tried to think about just about anything that somebody might ask. I'm sure we've not managed to do that, but we've managed an awful lot. So any questions, go there first, and then there's an option to contact us as well, so somebody will get back to you if you have questions.
Great. Thank you. Well, I'm eternally grateful for your time. It's great. I certainly will be signing up myself, and I think it's a great service. And and then I'm sure we'll meet again, and we'll talk about more maybe what PHA you're doing now too, and what plans you've got for that too. Yeah, lovely.
Thank you.
No, not at all. Thanks
really
so much.
Appreciate it.
Catch you next time. Bye bye.
Bye bye.
Bye bye.